You're watching your home team in the morning. Gary Moore and Sandy Gallant's Weather First Forecast. This is News 25 Today.
That's right. We have Dr. Robert Hagan in our studio this morning. Good morning to you,
Good morning,
sir.
Gary. Thanks.
All right. And you are a nerve surgeon.
Yes.
And we're here to talk about a new treatment regarding diabetics. There are risks for diabetics, amputations and chronic pain, and there are some new treatments that are out there. And one, I was talking to one of your aides on the phone earlier this morning, and she was telling me that sometimes diabetics may suffer from carpal tunnel. I didn't know that.
Yeah, I think it's generally accepted. We understand that diabetics will have an increased incidence of carpal tunnel syndrome. But what that really is it's a nerve compression. And we've understood that happens in the upper extremity. And now, for diabetics with peripheral neuropathy, we understand that it happens in the lower extremity as well. So we're taking old knowledge and applying it to new areas and for new populations of people. I always say, imagine if you had numbness and pain in your feet 24 hours a day, enough to wake you up every night and require you to take narcotics for pain. Or if you've ever woken up in the middle of the night with your foot asleep and tried to walk on it.
That's not a good thing.
No, you're very unstable. So these patients live like that 24 hours a day.
So there's a new surgery?
Right. So the surgery is decompression of these nerves. And the goal of the surgery is basically to prevent the ulcerations that we all think of when diabetics have on their feet, which ultimately leads to amputations. We get them off their medications and just provide them a much better way of life. Their quality of life increases tremendously.
So let's back up a little bit. So if a person is a diabetic and they are at a risk for an amputation or they're having some chronic pain, you're saying there's a preventive surgery,
that's right,
a nerve surgery,
exactly,
that can take some of that pressure off and avoid that. How prevalent is this new treatment?
Well, the treatment is new and is probably accessible at certain centers, but the number of patients is enormous, and it has a profound effect on our healthcare system. Last year alone, 100,000 amputations were performed secondary to diabetes. And that's a significant number. If you start doing the math and the effects on our healthcare system, it's a big deal. Not to mention the quality of life of these patients.
What is the surgery called?
It's essentially nerve decompression in the lower extremity, and which is aimed at certain anatomical points where we know that diabetics will be entrapped.
All right, very good. Dr. Robert Hagan, a nerve surgeon, thanks for coming to our studio this morning and shedding some light on a new treatment for diabetics.
Thank you very much.
We're headed to a break when News 25 Today continues. We will have a look at our forecast from Susanna. Don't go away.